Most guys I talk to in clinic describe the same thing. They're tired all the time, they're not motivated the way they used to be, and somewhere along the way, they stop feeling like themselves. And a majority of them say the same thing. I just figured it was part of getting older. And look, aging's real. But a lot of what men chalk up to aging is actually a hormonal problem that can be identified, evaluated, and addressed. Today, we're going to talk about testosterone, what it actually does, why it declines, how it should be properly assessed, and what the science says about treatment. I'm Dr. Kabir Harricharan Singh, a physician who practices medicine with the approach that I don't wait for disease to show up. I look for the earliest signals so we can act before things progress. And testosterone is one of the most misunderstood, overhyped, and under-discussed hormones in men's health. Before we get into it a little bit further, here's a quick disclaimer. Even though I'm a physician, I'm not your physician. This is educational information only, not personal medical advice. Always discuss decisions with your own doctor. Okay, let's get into it. When most people hear testosterone, they think about muscle, sex drive, and masculinity. And yes, it does all of that. But that's a pretty narrow view of what's actually a system-wide hormone, because testosterone influences muscle mass and strength, bone density, mood and mental clarity, how your body distributes fat, red blood cell production, and metabolic health. So when we talk about testosterone, we're talking about more than just libido or gym performance. We're talking about a hormone that touches every system in the body, and clinical trials in men with confirmed testosterone deficiency have shown improvement in these areas with appropriate therapy. Now, here's something most folks don't know. Testosterone naturally declines about 1 to 2% per year after the age of 30, and the likely contributors to this are excess body fat, especially that around the organs, which we call visceral fat, chronic stress, poor or insufficient sleep, sedentary lifestyle, environmental endocrine disruptors, and metabolic dysfunction. In other words, this isn't always purely about age. So what does low testosterone actually look like? The symptoms can be subtle, and they tend to creep up on you. Kind of like a credit card bill you forgot about. Don't ask me how I know. Anyway, some of the most common symptoms I see are chronic persistent fatigue that doesn't resolve with rest, reduced libido, fewer spontaneous or morning erections, low mood, irritability or depression, loss of muscle mass or difficulty maintaining it, increased body fat, particularly around the belly, decline in motivation or drive, and poor recovery after exercises. But this is important. Symptoms alone don't make the diagnosis. The Endocrine Society's guidelines are clear on this. Testosterone deficiency is diagnosed when symptoms are present and affecting quality of life and consistently low testosterone levels on exam. One without the other isn't enough to justify treatment. This is where I see a lot of mistakes, even from well-meaning clinicians. Testosterone isn't an any time of the day test. Levels fluctuate significantly across the day, peaking in the morning. So testing should happen between 7 and 10 a.m., ideally on 2 separate occasions, but a proper hormonal workup goes beyond just total testosterone. It usually includes total testosterone, free testosterone, sex hormone binding globulin, luteinizing hormone, and follicle stimulating hormone, because this tells us where the problem is coming from. Is it the testes themselves, or is it the brain not sending the right signals? That distinction completely changes how we treat it. Now, testosterone therapy isn't a magic bullet, and it's not as dangerous as some people make it sound either. The truth is somewhere in the middle, and it's not for everyone. Testosterone therapy should not be initiated in men with prostate cancer, untreated severe sleep apnea, significantly elevated hematocrit, meaning your blood is too thick, and uncontrolled heart failure. This is why having a physician who actually knows what they're doing and who will monitor you properly is non-negotiable. Before testosterone therapy is considered, it's important to ask, why is testosterone low in the first place? Because hormones don't exist in isolation. They're embedded in a larger metabolic ecosystem, and if we don't address that, we're just patching over the problem. In a lot of cases, the answer is something we can affect without medication, and it's things like significant visceral fat, the fat around the organs, which convert testosterone to estrogen, insulin resistance, chronic poor sleep, alcohol use, which suppresses testosterone production, and nutrient deficiencies. And the research is clear that lifestyle interventions can move the needle significantly, and doing things like resistance training, weight loss, especially fat loss, getting adequate and consistent sleep, reducing or eliminating alcohol, and improving metabolic health all add up. I'll keep this short, but the biggest mistake I see men make is going to one of two extremes. Either they ignore the symptoms entirely, saying, "It's just aging, what can you do?" and they spend years feeling worse than they need to, or they go to the other extreme and jump straight into testosterone therapy without a proper workup, without understanding the root cause, and without any real medical oversight. Both of these are problems, but what I'm describing today is the middle path. It's a thorough evaluation, understanding the why, addressing what you can with lifestyle, and then making a thoughtful, evidence-based decision about whether therapy is appropriate for you. Remember, the future of medicine isn't reactive, it's proactive. I'll see you in the next one.